And ladies and gentlemen, for the second part of our briefing, we're very pleased to have with us here today Ging, the Operations Director for the Office for the Coordination of Humanitarian Affairs. Mr. Ging, the floor is yours.
Thank you very much, Farhan. Good afternoon, ladies and gentlemen. I just want to take the opportunity to brief you on my recent mission to the Ebola-affected countries. I was in UNMIR headquarters and also the three affected countries from the 25th to the 31st of January, so last week. And going through these countries, of course, the scale and scope of this crisis is, of course, very, very evident. If we recall the numbers that the World Health Organization have been communicating globally, at 22,500 reported cases and almost 9,000 people having died, 800 of them reportedly to be health workers being affected, and 500 of those health workers having sadly and tragically lost their lives. We are, though, seeing the crisis turning. It is now most definitely there is a situation where the international and national efforts are definitely on the initiative towards the elimination of this virus. But there is absolutely no room for complacency. The message that I was receiving everywhere I went was that the last mile is the hardest mile in this battle to eliminate the virus in the region. And we've seen that just in this last week, that prior to that, the number of cases had dropped below 100 across the sub-region, which was the lowest number since the June of last year. But unfortunately, in the last week, the numbers have gone up again. So now we see that across the three countries, 124 new cases being reported. In Sierra Leone, they've had the highest number of new cases at 80 last week, compared with 65 the week before. In Guinea, 39 new cases last week, compared with 30 the week before. And in Liberia, 5 new cases, compared with 4 from the week before. As I said, this is evidence of there being no room for complacency, and reinforcing, of course, the words of all of our partners on the ground that the hardest work is ahead of us. There are now at least 50 micro outbreaks across the three countries, and our partners highlight that it's the tracing that must be a focus in terms of quality, so that each case can be tracked and all the contacts can be tracked. In Liberia, we see, for example, in the most recent cases, that 100% of the new cases are coming from contact lists. So that means that the system is really working as it should there. It's not as good in Guinea or in Sierra Leone, where in Guinea only 45% of the confirmed cases come from contact lists, and in Sierra Leone 79% of the recent cases were not on confirmed list either. So again, that just shows you that that there is a real challenge around the follow through to make sure that the recording is accurate, and what we have to realize is that every single outbreak is potentially another outbreak generating more infection in the community. We also have seen, of course, the devastating consequences. I mean, 22 million people live in this affected region. 10,000 children have lost one or both of their parents. There are thousands of survivors, but they now face tremendous psychosocial and physical disabilities. We're seeing more and more cases of chronic fatigue, arthritis, hearing and vision impairment, cognitive difficulties, and again, our health colleagues are telling us that they fear that it's going to be more and more difficult for those who have been exposed to this virus, and even those who have survived. We also need to recall that in the age group that have lost their lives, these are predominantly the breadwinners for families, so that has a very direct impact as well. I would also like to highlight that as the other elements of the impact, there are 5 million children across this region who have not been at school now since last year, since the closure of schools at the end of the last academic year last June. So they have been without education. Vaccination campaigns across the region have also been suspended, and we are very worried about the potential now for measles outbreak. Also, we have to be aware that we're going into the rainy season, and we can expect that malaria will be on the increase pretty dramatically, as it does every year. And this is again the reality at the community level. So much has been affected. There are so many humanitarian consequences arising from this crisis that we have a huge amount of work to do. Now, eliminating Ebola is a joint effort. It starts with the community, and it is incredibly impressive to see the community mobilization in their efforts to defeat this virus. It has required cultural and behavioral change. It has required incredible courage and resilience at the community level in every respect. But again, everybody recognizes and acknowledges that the community are the key. We are joined in that effort. The governments in each of the countries, they are also key to the success, and we have seen governments stepping up with heads of state personally involved, giving daily direction. That's what it has required. And then the massive international effort that has mobilized in support of communities and national governments in this fight. Again, very impressive to see the quality, the scale of the international mobilization. The people who have gone out there, healthcare workers and so many others, the militaries who have the national militaries from a number of member states who have also deployed. It's really a very, very impressive and effective international mobilization of effort. There are so many organizations. I myself visited the International Medical Corps Ebola treatment unit in Lusar in Port Loko district of Sierra Leone, and saw firsthand the compassion, the dedication of medical staff and the other workers in that centre doing heroic work, and that's how I could best describe it, in very, very challenging physical conditions, and also, as we know, with risks to their own health. But again, the professionalism of how these treatment centres work to protect all who are working there, again, very, very impressive. I was also pleased to see the effort to make it as human as possible, reaching out to communities, following up with the communities about those patients who are in the centres, making sure that there is contact by telephone and so forth. I mean, again, a humane effort to try to make the situation as humane as one would and can have it to be in such circumstances. It's also important that people understand at the community level that early detection is the key to survival. Early detection, early treatment is the way to protect families from infection, but also for the infected, the people who are the victims themselves, if they get into these centres early, then the prospects of their survival are hugely increased. And we are seeing an increase in the survival rates as a result of people coming forward quicker for early detection. But we shouldn't underestimate the challenges around this issue of getting the communities to work to support the endeavour. Communication, for example, in Guinea is a big challenge. Only 2% of the population have access to television. 42% have access to radio. So obviously radio has to be the preferred means. But that's not enough either. There's a lot of sensitization has to go on in community outreach. We're also seeing that encounters resistance. So there's a lot of misperception that aid workers have to overcome and try to convince community leaders away from the misinformation that sadly takes hold in such and often in such crises. And again, we've seen incidents of violence against aid workers as they've tried to do their job. Now, all of that is to say that there is most definitely a fantastic effort, combined community, national and international, which has turned this crisis around. But the message coming through is no room for complacency. Last mile is the hardest mile, and we have to stay the course, not just through the elimination of Ebola from these countries, but also for the transition to early recovery and the restoration of public services. This crisis has exposed very clearly weaknesses in the health service delivery for the populations in these countries. The pivoting of the massive resources that are available in the fight against Ebola into that early recovery, where maternal health care and all of the other basic health services can actually be resumed and in many instances started anew for these communities that have really experienced such tragedy over this last year. This is our responsibility. Our responsibility is to follow through also on all of the other humanitarian consequences that are being felt so gravely by communities. Communities are mobilised, and that's a positive, and they will work with us, getting kids back into school and getting full school attendance, whereas before the Ebola crisis it was only around 80%. This has to be an objective to help these countries to get back on their feet as quickly as possible. So a huge effort underway, humbling to experience and to witness it, tragic to see the suffering that has taken place, but inspiring also to see the mobilisation of action. And now we hope that there will be the resolve to stay the course, to eliminate the virus, and also to deal with all the other issues that are the consequences of this tragedy and help these countries to build back better. Thank you.
Thanks very much. If you can all identify yourselves. Ali?
Thank you. On behalf of the United Nations Correspondents Association, welcome and thank you for this briefing. And thank you for our president who let me thank you and welcome you here. My question is, what from your what you saw there, what additional assets do you think your teams on the ground there need in order to meet the challenges that you just described here, including at the human level or the financial assets that you need? Thank you.
Thank you. Of course, it comes down to funding, but it also comes down to the ability also to be flexible with that funding. This is a fast-moving situation, so our message to our donors is that we need them obviously to stay very focused on the elimination of the virus, which means, getting down to 0 cases. and that's very tough because you have to track everybody and every contact, and then make sure that there is all the isolation and the other elements to addressing the elimination of contamination and cross-infection and so forth. That's one element. So no room for complacency just because the numbers have come down dramatically. It means that this crisis is brought under control and now is on track to be concluded, but only if there is the same level and intensity of engagement and commitment. In the meantime and concurrently, we also have to address the other issues that are coming more and more evident, which are the other humanitarian consequences. And on that, there has also got to be a scaling up of effort, particularly around healthcare services, especially as we head into the malaria season, and also around getting children back into school, because these kids have no future unless they can get back into school. And that requires, again, resources to support these countries to be able to do that, to deliver these very important public services and many other public services that people will need to recover from this crisis.
Can you be please specific about how much funding do you need in addition to what you already have? Thank you.
Well, the funding requirements are out there on the web at the moment in terms of the percentages that we're running at. At the moment, it's 54% funded. The campaign, the initiative to deal with this crisis, and what we have to also prepare our donor community for is that they will also have an international plan for recovery, which will be coming to them very soon. And as you know, there is a big meeting coming up in Brussels next month, which will address, the next phase of international engagement in support of these countries to recover from this. But again, recovery concurrent with the elimination. We cannot take our focus away from the very hard work that remains still to be done on eliminating this virus.
Carmen?
Thank you very much. Mr. Ging, Carmen Maria Rodriguez of Radio Marti, you say that you're very impressed by the international outpouring. Among others, please, would you highlight the contribution of Cuban professional medical workers there? Thank you.
Thank you. I'm certainly very pleased to highlight the contribution of Cuban medical workers who are running treatment centers, also from so many countries. And again, it's listed. I wouldn't do justice if I was only to list the ones that I have from my memory, but I do really commend everybody to look at the list of all the foreign nationals that have gone out there, health workers, also aid workers, to be on the front line, which is a risk also to their lives, without which everybody acknowledges this crisis would not be brought under control. So again, we salute them and we salute all of the organizations, international non-governmental organizations who've been on the front line for so long. They have really, they've really been quite inspiring. Thank you.
Masood?
Yes, thank you, Mr. Ging, for this press briefing. I'd like to know, in the wake of all that you've told us just now, do you estimate, in your estimation, is there a timeline to a turn to some sort of there's a light at the end of the tunnel that you see, and when do you see that is going to happen in the African countries which are affected by Ebola and so forth?
Well, again, this is the key question that for first and foremost the people in the region want to know: when can they get to zero case? The good news is that it's not anymore a question of if they will get to a zero case. It is a question of when. A couple of months ago, there was nobody felt that this crisis would be brought under control. A lot of people were worried that it was going to continue to be out of control. So that has brought a sense of hope for the people in the region. They see the crisis being brought under control, and dramatically so. The number of cases have been reduced very dramatically. But they're also very concerned that, you know, all of this began with one case. So there is no room for complacency. They're hoping, I mean, in Guinea, the government have published a 60-day plan. So the 60 days to zero is what they're saying. So they hope that they will get there in the next 60 days to zero case. In the other countries, they're also working now very intensively to get to that zero case. I didn't hear anybody putting a date on it to say we will next week or the following week or in 2. But I did hear everybody saying every day we need to be working for zero case. And it starts with tracking every case and then having the situation that they have in Liberia where there are no surprises. That if somebody is infected, that they were already on a list because they were tracked and traced and so forth, and then isolated and are not infecting other people. The problem is when you have deaths that are not on the lists, then you have to start a new list around all of those and try to find out who they have been in contact with and who've been in contact with them, and so on and so forth. So I would suggest that people are very anxious to get to that zero case in each of the countries, and it's now a very real prospect. In the short term, it just depends on how quickly and effectively we, as a community, the people, the government and the international community can track down every case and isolate them from further infecting others. It really now is within grasp. So you're right, the light is there at the end of the tunnel for sure.
Yes, in the back.
Hi, thanks for the briefing. My name is Ibtisam Azim from Al Arabi Al Jadid newspaper. You talked about a broken health system in the 3 countries. Would you please give us any examples for how you want to fix this, how the UN want to try to help fix this? A specific example, since it was also broken for a long time, what is now different, how it's different now?
Well, the first thing to say is that this crisis has exposed the weakness in the health infrastructure in the 3 countries. And you must remember the history of these countries. These countries have come a long way very, very quickly. But what this crisis has exposed is their Achilles heels in public service, particularly in health, but not just in health. And that now gives us, the international community, the insight that also should generate a sense of responsibility to help. So we now know how weak the health sector is in each of these countries at the community level. I mean, for example, in Sierra Leone, this is a country with double-digit GDP growth. But if you have a look at where they are on the global list of maternal and child health care, they're down at the bottom, very close to it. So this is not a sustainable situation for a country. And of course, the leadership in Sierra Leone are well aware of this, and they cannot do everything within their own capacity. So now we, the international community, need to work with them and the other countries in the region on a practical level, focusing on, and I would advocate very strongly, on community impact. We've seen the community as the key in the fight against Ebola. They came together, they mobilized, they are the key. Now we need to go back to them in that mobilized state and talk to them about what they need as priority public services, particularly in healthcare. And I can tell you what I was being told out there is maternal and child healthcare first and foremost, because they're the ones who feel the effects of being at the bottom of the global list in terms of standards. So then, practically speaking, what can we do in our recovery plans to help to, in the short term, see significant and positive improvement in basic public health care. Education is another priority. That's what I was being told when I was there as well. Because again, people know that there is no future for their children unless they're getting education. But if you go to the schools now, sanitation in the schools is appalling. And that, of course, is a big risk factor when these kids go back into the schools. So what can we do as an international community? Practically speaking, we can actually help to put basic and adequate sanitation facilities into these schools, which is part of the fight against Ebola, but it's also way beyond that. The good news is that community practices in terms of washing hands and so on and so forth, there's been a step change in awareness of the importance of better practices around personal hygiene and so forth, and we need to build again on that. But again, facilities are a key issue that we cannot ignore now, because it's been very clearly exposed to us.
Thanks a lot. Matthew Lee, Intercity Press. On behalf of the Free UN Coalition for Access, thanks for doing these briefings when you get back from trips, and other USGs should do so. I wanted to ask about funding. There's this study that was published in the British Medical Journal that's described as an OCHA study, saying that only 40% of the $2.9 billion that was pledged actually reached the countries concerned by the end of the year. Is that? I guess that seemed pretty striking. Is there a lag? Has more arrived in the last month? And can it doesn't seem to jibe with what's on the OCHA or UNDP multi-partner trust fund page, which shows 95% has been paid in. So is the money actually been paid but hasn't arrived? And a second is just to see if you have a response to it. Today, the IMF Executive Board, or it was announced today, they did it yesterday, announced $100 million funding and $160 million more to come, basically to pay off the debt of these three countries. How helpful do you think that will be, and what more is needed? Thanks.
Well, on the second question first, the countries have asked for this, and of course, what we have to do is we have to support their requests, and it's good news. I mean, that would be my reaction. On the so-called report, they're quoting OCHA figures from our financial tracking system. It's not an OCHA report. And Dr. Nabarro actually addressed this this afternoon in a press conference in Geneva, so we can share what he actually said. He actually explained what the situation is on that. But it's not actually an OCHA report. It's that in that report they quoted the OCHA figures.
Beyond this, the numbers, the study seems to say to chide the UN system for not responding fast enough, saying that Guinea raised the alarm in March, but in fact WHO didn't make an appeal until August. I mean, I guess there's 20/20 hindsight, but what do you think of that?
I think it's there's no question at all. But we internationally did not mobilize quickly enough at the outset of this crisis, and we have a lot of lessons to learn around that. Our partners, MSF, were beating the drum for a long time, and we were not reacting in the way that we should have. And again, we have to account for that and make sure that that does not happen again in the future. So that's a widely held view, that we certainly did not react on the scale that we should have at the outset of this crisis, for sure.
Yeah, Joseph Klein, Canada Free Press. There have been reports, particularly in Guinea, of a drug that, in a pilot study, that has had some success in the early phases of Ebola. I'd like to know from your own observations to what extent this has been is being used. Are there plans to try to expand the availability of this drug if it continues to prove effective? What role does it play in the overall strategy? Thank you.
Essentially, the health workers out there are doing everything that they possibly can with the resources that are made available to them on the treatment side. And as I said, I think an untold story in this is that that treatment is possible. I mean, people are surviving, and the earlier you get into treatment, the better chances you have of survival. Now, when it comes to these experimental drugs there's very limited supply of those globally. But again, what I was hearing from medical workers, I didn't go to a centre where I've seen the report since I returned that you're referring to. But talking to medical professionals, what they've been reaching out for in terms of support and supplies is anything that will help them in case management, in treating these victims of the virus, and as I say, increasingly the capacity to care is improving, and as a result, the survival rates are improving. So we welcome the fast development of more drugs, and also, of course, we hope for the early development of a vaccine as well. We know that there's work going on that as well.
Thank you. Mr. Ging, you mentioned that you applauded the international mobilization to help fight Ebola. And you specifically mentioned those countries that have deployed military contingents. Besides the United States, which countries are providing military assistance? And secondly, it appears that the United States is planning perhaps to withdraw its military deployment. Is this something you agree with? Is this the right time?
There are a number of countries who have sent out military resources and also public service workers. We all know that in Liberia the U.S. were the largest there, and in Sierra Leone we have seen the British sending out a major contribution on that. I don't have to hand the list of every other country, so please forgive me that I'm not wishing not to recognise or acknowledge, but we can get you the details of the others. And what in terms of what's needed at a particular time, this is a fast-moving situation. So at the outset of the scaled-up international response, which we acknowledge was too late. We should have been responding much earlier to this crisis. But when it came to address a crisis that was spiraling out of control. We are now in another phase of the endeavour to combat this virus, and that requires a recalibration of our effort, which is going on all the time. Refocusing, reorientating, zoning in on what's most effective, and so forth. So it's the judgment call of those on the ground as to what configuration they need, whether they need to continue with military resources, whether they need to scale up other type of resources. And I must say, we should all applaud the leadership on the ground. They've done a phenomenal job. They have turned this from being out of control to being under control to the point of on a trajectory towards elimination, when a couple of months ago it was on a trajectory that was getting worse. So we salute the leadership out there, the leadership of the countries, the international leadership that have been deployed, and community leadership. They've really come together effectively. Now we have to work with them and be responsive. And if they're calling for certain support, I think we shouldn't be second-guessing. We should simply respond positively, because they're on the front line and they do know best.
Just to follow up on that, so you agree that it is an okay time for the United States or Britain or whichever countries to begin withdrawing their military contingents?
I have to say that we should support the decisions of the leadership on the ground. So if the leadership on the ground decide that this is the time to change the configuration, then we should have confidence. They've brought us this far successfully, and we need to get in behind whatever they are saying is the next phase. It's not. I have no expertise to pronounce that this is the moment for this or that. I'm not out there leading the effort, but I am coming back here to report to you that we should first and foremost be very appreciative of local leadership, national leadership, and international leadership who are out there on the front line. And secondly, we should have confidence in their leadership that they're making the right decisions. Thank you.
We have only a couple more minutes before our next speaker, and 2 more questions. So if you can ask your questions quickly, first you, and then you, and then
Thank you.
We'll wrap up.
Emma K. Bebiak with the German Press Agency. Mr. Ging, I want to ask you about the children who were orphaned by Ebola, and many of them were rejected by the extended families. Have you seen a reduction in their number? Is there a better understanding of the disease now?
No, we haven't. I think this is the stigma attached to Ebola has to be, we have to tackle that. And this is about the sensitization, the community outreach, the communication. As I said, we even have challenges in communicating our messaging and so forth. But again, I'm confident on the basis of what I've seen so far in, how organizations have tackled very, very difficult issues, and also so bravely. I mean, really, they have really been out there on the front line, risking their lives to also engage, to convince communities and community leaders on and around these issues, to dispel the myths and the propaganda and so forth. But there is a huge body of work to be done on the stigmatization of survivors and also the plight of orphans. And that's where we, as a humanitarian component of the international community, that's where we have to be. We have to be out there on the front line with these people through the next phase. The elimination of the virus is only one step in our responsibility to stay with these communities through their recovery. And there's a lot of issues that we will be challenged to address with the communities. But I'm sure we can do it because, again, when you've seen the impressive results so far, again, it's a matter of us staying the course.
I had the same question, so it's been answered. Thank you.
Thank you.
Great. Thanks very much. Thank you very much, Mr. King.
Thank you.